Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Meagan Peeters Gebler, an Appleton-based physical therapist with an extensive background in pelvic health and perinatal care. Meagan holds a doctorate in physical therapy from Marquette University, is a certified strength and conditioning specialist, and has advanced certifications in pelvic health, including pregnancy and postpartum corrective exercise specialist and certified birth healing practitioner. Meagan's passion for health and wellness led her into physical therapy, and now her work is all about helping women understand their bodies, heal with compassion, and build a positive connection between mind and body. When Meagan is not helping women regain strength and confidence, Meagan enjoys triathlon training, running, gardening, and spending time with her family, including her husband, 7-year-old son, and their 2-year-old golden retriever. In our 4 episodes together, we explore numerous hot topics related to pelvic health, as well as how Meagan helps to empower women to understand and work with their bodies for lasting positive change. Let's dive into today's conversation. Hello. Welcome back, everyone. We are here, episode number 4 with Meg. Welcome back, Meg.
Thank you.
I can't believe we're here in the last one already, but we have covered so many amazing topics. So if you guys have not gone back and listened to her first 3 episodes, those were absolute gold. We talked a lot about pelvic floor in all 3 episodes, and it's going to be similar this episode as well. However, we're going to be kind of backing up into more of a 10,000-foot view of how lifestyle habits can impact your pelvic floor health at every age and stage. So kind of what are you doing in your own home that's going to be impacting your pelvic floor health? And maybe you'll get some ideas on things that you can try and tweak. So let's just start and dive right in. And so, Meg, I'm going to ask you kind of a question to see what comes off the top of your head here. What is the first thing that comes to mind when you think about something we do or enjoy on a regular basis that may affect our pelvic health?
The first thing that comes to mind is sitting and driving.
Mm-hmm.
I think about how, as humans, we, through the years, have kind of narrowed our bandwidth of movement. And I think that, hundreds of years ago, we had much more variety and we had to do bigger reaches. We had to do deeper squats. We had to interact with our environment in different ways. But in that diversity, we maintained structure, function, and health of all of our tissues. And now we do such a narrow, amount of movements, and everything in life is so convenient and comfortable that we don't have to extend our reach and move more, that our bodies and the shape of our bodies are changing due to all of those conveniences.
So how does that actually impact the pelvic floor, sitting on a chair or a seat?
Yeah. So when we are in one position for a long time, a couple different things happen. Within 10 minutes, they have been able to visualize the development of trigger points. So when we are not moving, that blood flow gets stagnant. Those muscle tissues, become kind of thicker and more like beef jerky is how I describe it. And then with repetition and time, I think of it as the shape of our container changes. And the more you sit, the more you end up being shaped like a chair. Your hip flexors get tight. Your glutes get sluggish. When we have those imbalances, the position of our pelvis relative to our spine can change. The pressures and tensions on different organs and nerves changes. And then how we move when we go to stand up and walk around is going to recruit different muscles And oftentimes the pelvic floor gets a little bit lazy and starts to cling on for dear life. And we see that incoordination set in.
So what could someone do if they work a desk job or they have a long commute and their life really does just include a lot of sitting? What is a tip that you would give them to help combat that? Like obviously taking breaks, but is there like a certain exercise or something like are squats good to do in between? Or like what would be your tip for helping people who do sit a lot to make sure that they're not getting pulled into that permanent seated position like you talked about?
Yeah. Probably the easiest, most accessible movement is just a pelvic tilt. So just kind of slouching and sitting up tall and doing a few of those really often so that we get a little bit of joint lubrication through our spine. We also get a little bit of kind of pumping action of the muscles, I think is probably the easiest and doesn't require too much attention or too much movement.
Can you walk us through
disruptive?
that? Yeah, because I feel like when you say slouching, I think of like people are just going to crunch through their shoulders, but you're talking about pelvis here. So how do you actually do that?
Yeah. So, ideally your feet are going to be flat on the floor so that you're grounded and the weight of your legs then are not pulling on your pelvis. But what you're going to do is you're actually slouching from the bottom. So you're going to be shifting your weight back and allowing yourself to roll to the back of your sits bones, where then you will feel more pressure towards your tailbone. Your spine will take on more of a C shape. Your chest and your head will come forward. And then you reverse that by rolling up and over your sits bones. You'll feel your belly button move forward. Your shoulders and head will move back.
Okay. You are a master of words. Like to describe all that on the podcast where people can visualize, a master.
Should people be feeling a change in their actual muscles? Like, should they feel activation at all? Should they feel anything in their pelvic floor or their abs, or is it more of just like the movement piece that they should be focused on?
Yeah, I think just the movement alone is where the value is.
Okay. Yeah, I love that. I kind of want to take this episode and have you give us like quick tips for each of these different types of lifestyle factors, if you have them. So another one that I have a question about is diet. Does hydration or caffeine or alcohol or certain types of foods have an impact on our pelvic floor health?
Yeah. So the easiest one is hydration. I think a lot of times gals will get kind of caught in the trap of restricting fluids if they are experiencing leakage or urgency, which ends up being quite counterproductive. I describe that as, concentrated urine or urine that is going to be higher in irritants is going to be more disruptive to the lining of the bladder. So maintaining good hydration can help kind of dilute the irritable substances that you may be eating or drinking in other ways. The other is a lot of it is just paying attention because the sensitivities to different foods and, carbonation, citrus, caffeine, alcohol, kind of all can take different actions in each individual. So noticing trends and then choosing whether or not you want to participate in that.
When you say trends, could these types of foods or caffeine, like what would they notice that would kind of give them a little red flag? Oh, maybe caffeine affects me in a negative way.
Yeah, it might be that you feel like you have to go more often and more frequently. So shorter time in between trips to the bathroom, you may have a more intense urge where it feels like you have to get to the bathroom more emergently. Other things would be perhaps that the bladder feels a little bit irritable in that when you go to empty, you don't feel like you can get all the way empty, or it's like almost like a stuttering emptying where it's like, you have to go and then you go a little and then only a little bit comes out and you wait, but you still feel like you have to go. That can come from a bladder muscle that's irritated from something that you consume.
Okay. And do you have a recommendation on hydration? Like how much people should be drinking? And maybe not necessarily like ounces, but I think a lot of people in today's age are like, oh, I'm drinking soda or I'm drinking coffee or I'm drinking tea. Like, do all of these count toward hydration? Should they really try and have more of a water focus? Maybe throw a lemon in there or something. What's kind of your guidance and tips with hydration piece?
Yeah, I will guide gals to non-caffeinated, non-carbonated as their hydrating fluids. And then the other tip that I like to give is, kind of bookending irritants. So, I don't make anyone give anything up. There's different reasons we consume different things. But if that cup of coffee in the morning does trigger a few voids closer together and some urgency, if you consume a few ounces of water before that, you've now diluted the concentration of that irritant, and you've got happier, cleaner pee that your bladder will store, that then lets you maybe get away with something that if you didn't otherwise dilute it, may be more of a disruptor to your day.
Okay, so we talked about diet, we talked about sitting. So let's talk about exercise, which is probably one of those things that a lot of people will want to know about. How does it affect the pelvic floor? Maybe the lack of, maybe how about poor form and that sort of thing. So what's your perspective on exercise and how we should be doing it or what we should be doing? Kind of a broad question, but what's your perspective on that?
I think the first thing that popped into my mind is moderation, right? And that's coming from someone who's done really long endurance events and with some high intensity, right?
Do you take your own advice?
Yes. We evolve and grow, and yes, more now than in past years. So so I think it's moderation and listening to your body. And I again go back to that point that symptoms are clues. And if something is hurting, if you're feeling pressure or if you're leaking, that activity might not be the right fit at that time. And it doesn't mean always and forever. It just means something needs some attention. I do think that as a general, people need to move more just to combat, again, the conveniences of our lives and all the sitting.
And it could just even be simply walking. Right? Just going for a 10-minute walk in between calls or whatever, something simple like that. Are there any exercises that we should be avoiding? Maybe depending on, the state of their pelvic floor or maybe postpartum or anything like that. Do you have any opinions on that?
I don't think that there's anything broadly that we can say that we should avoid. Again, it depends upon what you have worked on through your years.
Well, maybe just to take that question one step further, if someone is listening to this series of episodes and they're saying, you know what, I am having a little bit of leaking or I am having a little bit of pressure here and there, but I do exercise a lot. In the interim, before they get in to see you, is there any tip that you would have for them to help, minimize pressure or certain exercises to avoid in that realm?
Yeah, I would say, for if someone's having pain, it would be getting, more detailed in what part of their activity. Is it at the beginning? Is it at the end? If it's coming on later in their workout, can they just stop their workout a little sooner and avoid that, compounding cumulative stress and strain? Or, okay, is it starting in the beginning? Well, then maybe we should change it up sooner than later. Mm-hmm. I think if it's leakage, it would be, okay, what part of that movement or activity is it? And then, if it's, for example, a runner, okay, if you can do an 8-minute mile and not feel any symptoms, but then when you bump it up to do a 7.5-minute mile, you start to experience that. It's okay, well, honor that distance or that speed rather, and then back it off a little.
Okay. Yeah, that is really helpful. How about posture? And I know we talked a little bit about sitting posture, but when I think about posture, the first thing that comes to my mind is moms and that season of littles, because your posture it can be really, really all over the place. And I loved our prior episodes of how we talked about re-strengthening your body. And there's some ailments that your body may have after pregnancy that you don't even know about unless you see someone like you. But in general, women are holding kiddos on their hips. They are baby wearing in the front and maybe pushing their hips forward to try and support that. They are crunched over with nursing or bottle feeding. So different postures. What would be your recommendation? Let's just talk first about women in that season and some tips you have for them. And then if you have anything that comes to mind for even older seasons or younger seasons of just common posture challenges that you see people have in today's age, let's talk about that.
So for the moms, the first thing I think of is keeping your load close. And that, when you are carrying your littles, trying to do your best to keep them either, in your midline, so on the front or the back, as opposed to one side or the other, and keeping them as close to your body as possible, with the idea being that the farther away from the center of our mass, the heavier things become. And so, the other controllable variable there is changing your center of mass. So is it doing a more of a staggered stance to help make sure that you're not thrusting your hips forward or kind of defaulting onto a kind of a passive stance? Or is it widening your stance so you're wider than hip width, where you can almost kind of create like a little kickstand effect to prop yourself up? And then the other piece of that would be moving often. So just trying not to stay in the same position long can reduce the impact of a bad posture and let it, move in and out of your life so you're not spending as much time there.
Okay. Let's talk briefly about a little bit later seasons in life. So like perimenopause, menopause, there's a lot of hormonal changes that are happening then. Is there anything that you commonly see with women? So Drea and I are in our mid to upper 30s. She's looking at me with an evil face right now. But, we're entering into that perimenopause phase. And so is there anything to kind of watch out for that present themselves as symptoms as our hormones are changing?
Yeah. So lots of different things.
Oh
no. Right. Just going back to the sleep, right? So disruptions in sleep can be common with those hormonal changes. I think, different joint pain, kind of, again, honoring kind of those end ranges, and movements, and really intuitively listening to what feels good and what doesn't. I think also recovery, really making sure that you're giving yourself time between more intense workouts, and then giving good focus to strength training and lean muscle mass for bone density, but then also just the health of the muscle.
Okay.
Yep.
Yeah.
Yep.
I think I can handle that. I think we can.
We definitely agree with that one.
Now, before we wrap up our last episode with you, I do want to just touch on, is there anything else that you help with? Like, I know that you are a triathlete. Do you love helping like runners and bikers? I know you also offer dry needling. What else would you say about things and people that you support?
Yeah. So I do love helping runners, triathletes, cyclists, and especially moms who may be navigating other variables in their day that are going to impact their ability to do those activities. And then, I do offer dry needling for trigger points. And that is something that, is close to a magic wand for anyone that's experienced it when the muscle needs that little nudge. And then I would say another population that I see a fair amount of is people with hypermobility. And I feel like it's something that is kind of gaining awareness, fortunately. But there's so many little things that we can do with how we change and interact with our environment and how we move that can really change someone's lives if they are kind of working through that increased mobility piece of, yeah.
Okay, awesome. And then just to close out our episodes together, I would love just to hear, why do you love what you do?
Yeah, so I love seeing people feel at home in their bodies and like seeing gals become friends with themselves again and find the passion in their movement and their well-being. And I think when we look at kind of how pelvic health lets me do that more is just the absolute kind of primitive nature of, birth and continence and digestion. And these are just such basic day-to-day activities that really are important for our overall vitality, that to help people improve those is very, very rewarding and empowering.
I feel like you bring not only hope back to people like through the process, but you bring them freedom, freedom back in their bodies to do what they love to do in this life. So thank you so much for joining us on all these episodes, but more importantly, thank you for serving the women in our area.
Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.